Hi, Stuart Carter here, registered massage therapist, manual osteopath, and starting in January of 2016, certified matrix repatterning practitioner. Today I'm going to be showing a bit of a demo on a treatment that I'm developing that I'll start doing in January. I'm going to call it the tune-up, and it's actually a mixture of some advanced myofascial techniques, so massage therapy, manual osteopathy, mostly craniosacral based, and then some matrix repatterning. So in each of these types of therapies, there's protocols that need to be done. So in matrix repatterning, they call it the big seven. So it's areas that need to be treated or emphasized when they show up. And in the osteopathic world or craniosacral, there's a 10-step protocol, and same with the myofascial release. So I'm working on developing, I'm going to show you a demo of that, of a tune-up session. It takes about 45 minutes, and it's between 20 and 25 different hand positions and areas that I feel that will help the body to systemically heal. So it'll be a sense of relaxation, the central nervous system will calm down, the lymphatic system will increase, and it just will be a really feel-good treatment. So my clients are looking forward to this because I've been talking to them about it, so I figured I'd show you guys. So the first step for that is I would work one side then the other for the lower body. I would get the leg up like this. I use this bolster here or roll. Oh, no, actually, you can keep going, I'll just splice it. So the first step I'm going to do is come down to the feet here, and I'm going to work on the leg. On the foot. I'm going to contain the foot and push down in the top here, and that would be the first hand position. This is part of the matrix repatterning. And wait for a release. That's a general release. Bend your knee, please. Now I put this bolster underneath, and this is a good release for the lower leg. So again, containing the area, finding where my hand needs to be that feels natural. That's the next position. The next position will be up here on the femur. Pushing down and containing in. Once I get those releases, that would be the lower part of the body, and then I can get into the pelvis a little bit. Goes over here. I would do that on both sides, by the way. I reach in on the top part of the ilium here and contain down on the front part of the ASIS, which is the other part of the ilium, or work on the femur on the side and do a containment there. So a couple different hand positions there to help release the top of the hip and the pelvis. Next hand position is why I have the sheet here. I would slide underneath the sheet onto the sacrum. So right now my hand is coupling the sacrum, and I push just above the pubis bone. This is the pelvic floor area. This is a nice release and balancing for the sacrum. Also work some of the lower organs there. Next hand position is just sliding up, my hand just sliding up, sort of on the other side of the belly button. Again, containing, or so pushing down with my top hand, stabilizing up on the low back with my bottom hand, working in the lumbar area. So now I would have her put her hand there, and I think I'm just going to get you to rest that hand there. So now I go on to the ribs here. This is respiratory diaphragm, so this is transverse planes of connective tissue that run through the body to support things. Pushing up and down, working above and around the connective tissue around the liver, the stomach, and the ribs, wherever I felt my hands needed to go. So you're working with the sacral plexus in this area and the solar plexus in this area. Bundles of nerves, so that's a nice way to calm those areas down. Next hand position is the thoracic inlet, reaching in through the upper thoracic spine, stabilizing the sternum and the collarbone on each side, affecting the ribs as well. And waiting for a nice release. If I felt like there's an area here that needed more work, I could use the bolster here and compress down onto the more broader sense of the collarbones, or even down here on the lower ribs, where I could use two of these bolsters. The next release is I'm going to stabilize the back of her neck, the C-spine, and put my hand on the front around the hyoid bone. This is a nice general cervical release, especially for the connective tissue. Waiting for any rebalancing there that needs to happen. Next position, I'd probably come to the head of the table, sit down, palpate and treat the neck as needed. I'll do the cranial base first, which is the bottom part of the head, the occiput, and the C1, C2 area. Waiting for a release there. It's called the cranial base release. Then if I felt that I needed to, I could go back and specifically work on the transverse processes or whatever vertebrae I feel may need some attention. And then I get into this, see the cranial part of this. I could do a general cranial release here, working on the occiput and the parietal bones at the same time. Same thing up here, parietal bones, temporal bones, waiting for releasing. So I'm waiting for releasing and balancing on right or left sides. Another release here, occiput, frontal bone, on top hand of the frontal bone. Another release here, top of the cervical vertebrae, affecting the condyles on the occiput, and pushing down through the frontal bone and the parietal bones in this area. Another release here on the temporal bones, thumbs on the back of the sphenoid, and the mandible maxilla here on the jaw. Nice release here. I can focus on the jaw more here, or do a general release across here. The same position, maxilla, mandible, temporal, frontal, this whole area here. Waiting for balancing and clearing in that area. Another release is scooping back under the sacrum and getting the client to lift their head up for 1 second, draw back into my hand. So I'm going to have my hand on the sacrum and the occiput at the same time, ready to rebalance and align the dural tube. That's going to have an effect on the whole central nervous system. Again, bringing more relaxation and increased immune response and stuff. So that night, the person's going to sleep really well. In fact, they probably will fall asleep on the table. And then at the end, I put my hands on their heels, do a little bit of a leg pull, make sure that the balance is finished up. Altogether, that's going to take about 45 minutes. Good part is because I'm a registered massage therapist, I can bill under massage therapy. I'm also a DOMP, which is a Diploma of Osteopathic Manual Practice. I can bill under osteopathy and include the matrix repatterning. That's what's called tune-up treatment. It's a great treatment. It can really help people just to feel good. People who don't really have any specific aches or pains. So thanks for your time. I hope you enjoyed this. Once again, if you need to book an appointment, you can call us at 905-967-0467, or you can go online and check out our websites, that's 4 W's, newmarketmassagetherapy.com. Oh, forget that. You can reach us at newmarketmassage.ca or newmarketosteoandmatrix.ca. So thank you for your time and have a wonderful day.